I was invited, and this was my question. I thought it would be a kind of interactive presentation now that we can discuss controversially, and I will plugs. Okay, so I have two cases. Okay, 15 minutes, two cases. So case number one: why is this patient difficult to treat? You know. Hello? Yeah. Do you have an idea why this lady is difficult to treat? Two problems. She is a very hypertonic type, problem number one, and she has very lateral forehead lines very close to the eyebrows. It's difficult to treat. So this is the result after 2 weeks. Okay? Looks good. So relaxed. So if we take a look to contraction before and afterwards, you see an excellent result. And what is important? Important is the fact that we definitely has not changed the position of the eyebrows. And this is the main problem. And the question is, how should we treat her? So at that time, it's 1 or 2 years old, this picture, I was treating her with 2 units, Inco or Onar, or 5 units Apo. And perhaps after the presentation today, I will treat her with multiple points. We have to check it. Multiple points, I'm not sure how long it lasts. That might be a discussion afterwards, after the presentation. And you remember my first slide of the anatomy and towing a rope in the morning. And I never treat the frontalis alone. I always treat the counteracting muscles. And you can see I always treat the corrugator to prevent a medial eyebrow ptosis. And now we take a look to the lateral part of the eyebrow, before and after, relaxed. And again, you see a very good result. And what is important, if you ask the lady for contraction, you see that she's able to lift up the eyebrow again. And this is important, very important for ladies when they want to put on their makeup and they want to look up. It's very, very important. So, and you see the position has not changed. What should we do in this case? And of course, microinjection technique. Microinjection technique, we told, I've been speaking about in the morning, you take a few units of the toxin and you inject it in different places. But don't think that micro-injection technique does not create any side effects. So I always treat in this part the counteracting muscles. I inject directly in the orbicularis. No picture, please, because of I don't have any license. Sorry, and I'm not allowed to do this. And I inject 2 units with a low dilution. I use, for treating the eyebrows, I use, in my case, 50 units Bocouture, I dilute with 0.5 ml. Because, you know, the higher dilution, the higher the spreading will be, automatically. It's a mechanical question. Okay, and I always treat, and you have to stay, I inject directly perpendicular in the orbicularis, and I inject 3 units in the lateral part. So I have the counteracting muscles. So let's take a look what happens if you don't do this. Another patient, still case number 1, you see, in relaxation, perfect result. But if you asked for a maximum contraction, do you see the difference? You see the difference. We still produce a kind of an eyebrow ptosis. This lady is not able to lift up a maximum her eyebrow. And that's because why? I didn't inject into the counteracting muscles. So you remember towing a rope, the balance, we always have to treat a functional system. So we come, where is it? So, and two ladies, they are also extremely difficult. And I want to show you my mistakes I was doing a few years ago, because we all learn from mistakes. We've heard this in the morning. And again, a hypertonic type. And you always, if you don't treat the counteracting muscles, you produce an eyebrow ptosis, like you can find here in this case. This lady suffers from a medial eyebrow ptosis, okay? And do you know why? Too many units. That was the first mistake. 3 units for each point is too much. Maximum 1 to 2 points. We've heard about today 6 points for forehead or whatever. It depends on the anatomy, of course. But this is the main problem. Look at this lady. That was absolutely a mistake to treat her. Do you know why? She has a problem. She needs a blepharoplastic. This is a problem first. And if you do something, and if you relax the frontalis, again with a wrong concentration, 3 units, it's too much. You create definitely an eyebrow ptosis, and this 1 millimeter will kill her. She doesn't like you as a physician. So always reduce the dose, reduce the concentration, and always treat the counteracting muscles. Okay? This was case number 1. Case number 2. Another lady, she came to me, and she complained about her forehead. She doesn't like her forehead. And if you analyze her face, it's not a problem of the forehead, it's a problem of her eyebrow. She has asymmetric eyebrows. And if you see it relaxed, you can see one thing. Sorry, too fast. She has, at maximum frown, it's not a problem of the frontalis. It's a problem of the corrugator and the orbicularis, oculi, the medial part of the right side. So, and you see, at a maximal contraction of the frontalis, it looks not so bad, but the relaxed situation, that's her problem. So, how should we treat her? And I have learned a lot out of the cases. My idea was to lift up the left eyebrow and to reduce a little bit the frontalis activity of the right side. So, I was treating her with 4 units, Bocutura in this case, and 3 units in the lateral orbicularis. And I performed an eyebrow lift. Again, 2 units, 2 units, 2 units in the eyebrow. At maximum contraction, I was injecting 1 unit for each point. Okay? That was the idea I had. But I made very big mistake. I will show you later. That was 3-4 years ago or 5 years ago or longer, whatever. So when we take a look to her, relaxed, before treatment and after treatment, the result is not so bad. I was lifting the eyebrow, okay? Looks not so bad. But let's take a look to her at maximum frown. I produce an asymmetry, of course. This patient will hate you because she reported about a very strange feeling. So never treat one side of corrugator alone. Ever treat both sides. So, you see, the result was not bad. On the right side, totally relaxed. But the left side, still activity, corrugator orbicularis. So, I was doing the next step. 4 units in the procerus, 3 units in the corrugator and the medial part. You never can differ the corrugator from the medial part of the orbicularis. It's a complex structure of muscles. And I wanted to lift up the right side again a little bit more. This was the idea. So, let's take a look 2 weeks after. What is the result? At maximum contraction, you see, it's much better. It's much better. She is relaxed, but she still has a different form of the eyebrow. So my idea was again, hey, create an artificial kind of an eyebrow ptosis, 1 unit again to that point, to change the form of the eyebrow. So I was playing with her. So maximum frown, 2 weeks. Oh, sorry, too fast. Where is it? So it blocks. So 2 weeks after the first treatment, 4 weeks at maximum frown. We see now a really, really good result. Do you see the difference now? So this was the result before. This was the result 4 weeks after the treatment. So if I ask her for a maximum contraction 2 weeks after the first treatment, and now you see 4 weeks after the first treatment, a really, really good result. And you see, my aim was to symmetricize her face, her eyebrows, and to give her a right form of the left eyebrow, because she had an hyperactivity of the left side and of the frontalis, and a hyperactivity of the corrugator and the orbicularis oculi on the right side. And this is the result before, 4 weeks after. You can see the difference. And last pictures. 2 weeks after the first treatment, 4 weeks after, before, and that's the result. So you can analyze finally the asymmetry has changed, and you see the difference in the eyebrows. So the take-home message is we can play with the elevators and with the depressors. We only have to know what we should do, and again, don't lose the balance. Thank you for the attention. Mille grazie.
Many